So the TCGA really provided a lot of new information. The TCGA really provided a lot of new information about bladder cancer. We recognize that just because you have a urothelial cancer, not all patients have the same cancer with the same behavior. There's a variety of different ways people are subtyping, whether or not by luminal versus basal. There are other subtypes, neuroendocrine, for example, and there's a breakdown in the luminal and in the basal groups. And that's just looking at RNA subtypes. There are a variety of other subtyping categorizations that are currently being explored. I think we're learning a little bit more about the subtypes. For example, the basal subtypes tend to be a little bit more aggressive than the luminal, but also may have a better response to chemotherapy than the luminal subtypes. Today at the meeting, I presented some data that we obtained from 200 patients who had TUR and subsequently had cystectomy without neoadjuvant chemotherapy. And we found that the luminal subtype were less likely to have non-organ confined disease compared to the non-luminal subtype. And we looked at the TCGA cohort and found very similar results as our multi-center study. And so if you could validate this, you might be able to find that some patients are more likely to benefit from neoadjuvant chemotherapy because they're more likely to have non-organ confined disease. And those patients with organ confined disease may eventually be able to avoid additional treatments and just have curative approaches.